All right. Thank you so much. And really thanks to all of you for being on, but even more for the work you've been doing and the role that you're going to be playing in this most essential part of us getting really past COVID as a city. I'm Allison Arwady. I'm the commissioner here at the Chicago Department of Public Health. And like you, I spend a lot of my time really answering questions about COVID. And it was really helpful to see some of the questions that came through here, whether we're thinking about questions related to the development of the vaccine, some of the medical questions, some myths that are coming up, some of the logistics around distribution, and some of the questions related to policy of how vaccine is being distributed. So as some of you may know, and after this, hopefully all of you will know, we've been working hard to help turn a lot of these questions that you're raising, things that you're hearing in the community, concerns that and potential barriers to vaccine. We've been working to help turn those into answers. And I know a lot of you have already started to be able to answer some of these questions. We are working with the communications team here to develop written answers, video answers, some from me, many from other doctors in the community, really wanting to make sure, and not just doctors, but medical providers. And then once we get sort of beyond the medical questions, other community members really wanting to highlight the questions that are coming up frequently. So it's very, very helpful to hear from you what are some of the things that you're hearing, particularly around vaccine hesitancy. Here at CDPH, we had done some work actually over the last year assessing how likely was it that people were going to take vaccine? What were some of the barriers there? What were some of the limits? And now that we have started vaccination, we, of course, right now in phase 1A are just in our healthcare worker and our congregate setting mode. But even there, we are seeing some more hesitation in terms of initial vaccine uptake, particularly in some of the healthcare workers who are in more of the support roles. We know that vaccine acceptance does often go along very clearly with level of education. And so one of the important roles that all of you will help us play is building some of that education around vaccine. I fully expect, and you all should fully expect, and absolutely welcome questions about vaccine. I like it more when people have questions about vaccines. It means they're thinking about it. They've been, pulling in information. It's something that they're considering. They're interested in the conversation. In a lot of ways, I enjoy more engaging with people who do have some very real questions, as long as I'm able to have some of the answers that can help reassure people that their questions are absolutely valid. They're questions that we hear a lot. They're questions that we don't always have the answers to, which is another important piece of this, right? Like, we want to be very clear about where the science is very strong, where we have good answers. And then there are some areas where we're still learning. So for example, the safety data on both of the two vaccines that are available is really, really strong. All of the processes for getting these vaccines approved, the scientific processes were the same that we've used for approving all of our other approved childhood and other vaccines. So any process, I know a typical concern is that, was this process rushed in some way? And the actual scientific process of testing these vaccines, particularly for safety, was not rushed. And that there were, years and years of research that were done in the laboratory that the scientists were able to really build on when it came time to using this vaccine in some of the trials, but that, and we can talk in some more detail, but that we went through all of the same levels of trials, and that the safety data is first and foremost what we're the most concerned about making sure looks good, and it looks really good. And then similarly, the efficacy data, that both of these vaccines, 94 to 95% effective in terms of protecting people from COVID, really strong. That is even better than we were expecting for an initial COVID vaccine. So I can feel very confident in that data because I've had the opportunity to, read some of the scientific reports. I sort of know a lot about the process of how vaccines are developed. But I know that all of you, may not have that background right off the baseline. And more importantly, the people who you're going to talk to, many of them sort of won't know that. And so we've been working to try to put together and then post on the website some answers to these questions. And a lot of, I think, your goal is to, do some education yourself, definitely be raising these questions. And then we're trying to sort of put this in Chicago terms as much as we can. So for example, I feel very confident that the Pfizer vaccine, the Moderna vaccine, that the safety data is good because they were given to, yes, tens of thousands of people, but also really pointing out that a lot of those people were here in Chicago, and that we had, that part of the trials for getting this vaccine approved were volunteers here in Chicago, and that we had very good racial and ethnic diversity among trial participants, particularly here in Chicago, better than in a lot of cities around and other states around the country. And so the fact that the vaccine in the trials was both safe and effective across all of the whole trial population, but also where it was broken down by race or ethnicity or underlying conditions, really consistently seeing that this vaccine looked to be safe and effective. So I've been making, personally, some videos. Some of you may know that we film a Facebook Live at least twice a week, every Tuesday and Thursday at 11 a.m. Occasionally we move the time, but we put it out on social media if so. Every Tuesday and Thursday at 11 a.m., I take questions directly from the public. We take them live, whatever comes in through Facebook and Twitter, and we'll often sort of have themes. So for the last, few weeks, a lot of those have been vaccine themed. And then any of the questions that we're seeing come up repeatedly, we're also doing these very short, 1-minute clips, COVID questions answered, that again, we're posting on social media, but also working to get on the website. Those are being translated into Spanish. And then we do have Dr. Geraldine Luna, who's one of the CDPH medical directors here, who's a native Spanish speaker, has been also re-recording ones in Spanish to make sure that those are highly available. And then some of the other languages, we're doing more just in writing it at this point. But where it comes to, so the number one ask for you, I think, is to get familiar with, for one thing, the CDPH vaccine website, because we are absolutely taking, the information we're getting from all of you, the questions, the concerns, and working. And we have some communications firms on board now that are helping to sort of turn these questions into materials. Right off the bat, here's some written answers, here's some video, and then here's some more community conversation about it. So if you've not been to the city's coronavirus website, always chicago.gov/coronavirus is your one-stop shop for everything related to COVID in Chicago. And then right up at the top, there's a number of tabs you should explore a little bit, but there's one called vaccine. And that vaccine tab will take you down into the vaccine website, which there's a lot of people working on to answer a lot of these frequently asked questions, to develop materials. And we've created a message map, which is sort of, there's a lot more detail in there, usually more than you'll need for community level conversations, but we've made them open so you're able to dig in and understand some more, what some of those questions are. And so we're also developing some sort of behind vaccine science little mini videos that are about 3 minutes long that are meant for the general public to answer some of the more scientific questions. And then I think when it comes to the myths in particular, this is where we're wanting to be pretty nimble about the things that are coming up, because I think social media can play a pretty strong role here. You can see one video or one piece of misinformation really get forwarded, and a lot of people then have concerns about that. And so I see even here a number of the questions that are coming up. And I could address some of those directly if that's what the team would like me to do, just to start giving a sense of how I might answer some of this. But there are so many questions that I know it would be hard to get some of these in directly. But if we just take, I'm looking to see here, has there been any link to, problems with getting pregnant, infertility, et cetera? No, there has not. But this is an example of a myth that has been circulating pretty widely. Do people having diabetes or older age or underlying diseases have a side effect from taking the vaccine? No. And these people were included in the trials, and the safety and efficacy, looked good there. If you already had a mild COVID case, what will the vaccine prevent in the future? The idea is that if you've had a mild COVID case, yes, you have to a level, your immune system has been exposed to COVID, and you've built some antibodies, which is what we call the immune system's response to COVID. But the problem is that if you've just been exposed to COVID, you haven't gotten the vaccine, but you've just been exposed and you've had COVID before, yes, you've likely mounted some immune response, but there's a lot of variability in terms of what that looks like. We all know people who probably had very mild COVID or maybe even no symptoms of COVID. They don't mount as strong of an immune response. On the other hand, there can be people who got very seriously ill, and at least some studies have suggested that their immune response, if they're so ill, is also, sort of not fully like you might expect it to be. And there's a lot of things that sort of go into immunity, but in natural infection, the CDC has said they think that you probably have some antibodies. There's some level of protection, may last sort of 3 months or more. This is an area where we don't fully know. The vaccine is designed to be much more predictable. You can get that immune protection without getting sick, because the vaccine absolutely cannot give you COVID. It doesn't contain any COVID virus, any part of the COVID virus. It doesn't contain dead COVID virus, inactivated COVID virus, no part of the COVID virus. Impossible for the vaccine to give you COVID. And so if people are having some of those side effects right after getting the vaccine, that is not COVID-19. It's one of the most common questions I get. It is your immune system learning how to protect you against COVID in case you are exposed, to the real thing. And so, I got the vaccine myself. I didn't have really many symptoms at all. For about a day, I had just a little bit of a sore arm. I wouldn't have really called it painful. I didn't have any of the, feeling tired or the headache or the slight fever, that some people have reported for a day or two. But if they're reporting that, that's not COVID. That's just your immune system learning how to respond. And that's kind of an important piece. But the idea is that you get this predictable immune response from this, that they've checked across the trials, and everybody's getting the same dose of the vaccine, which gives a more predictable immune response. And that is thought to be much more, hopefully long lasting, although we're still working on that part of the question, but also gives you more, you can kind of hold on to that protection more than if you were exposed naturally, and everybody gets exposed to a different amount of COVID, has a different amount of immune response to it. And so if somebody did have a mild COVID case and then they got the vaccine, you could think of that vaccine as sort of being a booster to their immune system. And so, yes, everybody, even if they have had COVID in the past, is recommended to get this vaccine. I'm also just seeing quickly, will the vaccine be available to children in a similar fashion to other childhood vaccinations? Will it prevent them from going to daycare? And some questions about timeline. So at the very highest level, there are 2 approved vaccines right now, the Pfizer and the Moderna vaccine. They both work with very similar technology. They use what's called mRNA. And they are being made as quickly as they can be, but it's really production of the vaccine that is holding us back at this point. We're receiving here in Chicago about 33,000 first doses a week between those 2 vaccines. And that's a lot, but where you think about the whole population of Chicago, at that rate, it would take a year and a half for us to get through all of Chicago. We are expecting that production to really go up. We're also hoping there will be additional vaccines that get approved, as the months go on. And as vaccine production improves, we will be able to more quickly roll out more vaccine. But in this 1A phase that we're in now, healthcare workers and our congregate settings, our long-term care facility, we're going to be in that phase really for the rest of January. We have like hundreds of thousands of people in that phase who still need to be vaccinated. Then when we move into the next phase, 1B, that will be older Chicagoans, and it will be some of these frontline essential workers. So that's where we start talking about transit, the bus drivers and the grocery store workers and the people working in manufacturing, the educators, the postal office workers. There's been some defined categories where we've seen a lot of outbreaks, we've seen a lot of risk. And here in Chicago, a lot of our hardest hit communities have a lot of people working in these jobs. And it's part of why we've seen higher COVID rates there. So we'll be focusing really, as we move into 1B on older Chicagoans, of course, at higher risk for hospitalization and death, as well as people in these frontline occupations. And we'll be working in partnership with employers to make vaccine available through those groups. And then after that sort of jumpstart in 1C is when we really open up. We start talking about everybody over the age of 16 who has underlying conditions, okay? And that's like a lot of the city. If you start talking about obesity as an underlying condition, some of the other things that have been shown to have more of a concern for COVID. So it's anybody over 16 with underlying conditions, and as well as all of the other essential workers. So we're starting again with some of the groups that have been hardest hit, but in 1C, any of the essential workers that were defined federally that were under the stay-at-home order were we're working would be sort of in that 1C group. And then that's really it in terms of prioritization. After that, it's anybody in Chicago. And so it is going to take us really through the spring to work through these groups. I would expect we'll start 1B probably in February. And then it just depends how quickly vaccine comes. But 1C would probably be a little bit later in the spring. So the work that you all are doing right now is a lot about, right now in 1A, are there healthcare workers who, have not gotten the vaccine, who need some education, who need some encouragement, who need to know how to connect to some of the vaccine opportunities. Very shortly, though, as we go to 1B, there's going to be a lot of essential workers and a lot of older Chicagoans that will be needing to do a lot of outreach and answering questions on. And then 1C is when things are really significantly going to be opening up. And there will be opportunities for you likely to be helping people make appointments, for example, to really be doing more of this direct outreach, and you'll hear more about this. But right now, answering these questions. And so back to the kind of original, you didn't hear me say anything about children there. And that's because the trials are not done yet for children. Absolutely, vaccine safety and effectiveness are the two things that underlie all of this. We will not recommend a vaccine that has not been proven to be safe and effective using all of the same safety and efficacy measures that are used for any of the existing vaccines. And so if you look back to when flu vaccines started at the beginning, or HPV or any of these other ones, you start with adults and then you work backwards and you do some of the, once you can see that it's safe and effective in adults. Children have pretty different immune systems than adults. An infant's immune system is very different than a teenager's. And there needs to be some more specific work. There may need to be different vaccine dosing, for example, for children that adults might get. And these questions all need to be answered before vaccine will be available to children. So they are just in the process now of getting some sort of 12 to 17-year-olds in the trials. And so that is getting underway. And maybe those trials will be done perhaps by the summer. We may be able to start vaccinating some of those older kids, possibly this summer. But some of the younger kids, it may even be beyond that. I don't know for sure, but what I do know is we won't recommend it for children, again, until we're just as sure that the safety and efficacy data is as good for children as it is for adults. So I don't expect there will be, probably even by fall, universal vaccination for children. I do think by fall there will be universal vaccination available for adults, but this is sort of going to be a process. And then maybe just another couple here, or maybe just one more for some time. So, and there's a lot of good questions in here. And again, where we don't get to these questions, we work to turn them into answers sort of on the website, answers on the thing. So, you know, as you can explore this, so I think the last one I'll take, because this is a good myth one, is this one about, I've been reading about people who don't have symptoms or any underlying diseases passing away a few days after taking the shot. What is the percentage of this commonly happening? So first, this is not common at all. And importantly, in the trials, which again, in the trials is when you have tens of thousands of people, you give the vaccine to, you give the real vaccine to half the people, and you give a dummy shot, a placebo, to the other half of the people. The person doesn't know if they got the real vaccine. The doctor doesn't know if they got the real vaccine. Everybody knows they got a shot. And then you follow everybody forward over months, and you see how likely was it that people got COVID or had other things happen. And so even in these trials, there were some people who died in the trials, but they didn't die related to the vaccine. They died, and in fact, more people died who got the dummy shot than got the real shot, than got the COVID vaccine, because people continue to have heart attacks or get hit by cars or have other things happen to them. And people will die not related to the vaccine. So there was no evidence at all in these vaccine trials that the vaccine, you know, not only did it not cause serious side effects, it definitely did not cause deaths. A vaccine would not be approved if there was any suggestion that a vaccine had led to deaths. Now, I think where this question comes is that who are we prioritizing vaccinating right now? We're prioritizing vaccinating people who live in long-term care facilities. These are people who are like 100 years old in some cases, 90 plus years old. They absolutely should get vaccine. They're at very high risk for COVID infection and death. But people who are 103 have, you know, sometimes will die, even if they've recently gotten the vaccine, regardless of whether that has anything to do with the vaccine. And so it is not unexpected that there will be people who will die, sometimes even shortly after getting the vaccine, not related to the vaccine. And I think that's going to be an important sort of myth that we work on having people understand. It is not common at all. And in fact, I don't even think in Chicago, we've had an instance at this point of anybody dying shortly after getting the vaccine. Anything where somebody gets sick or there's a potential death, that's all reported to the CDC, that's all investigated. But these are the kinds of things that will often circulate and that we'll be working on. So I just took a few of these here quickly just to kind of give you a sense. But you are going to be really important in this process as you're able to educate yourselves, and then in turn, work to help us get the right news about vaccine out to people here in Chicago. So explore that website. I would encourage you maybe, you know, at least there's a lot of resources, not like mine are the only ones at all, but we are trying to post online where there are other good opportunities. This Thursday at 6 o'clock, for example, there's a very large sort of national conversation that's going to be streamed on social media about what Black Americans should know about the COVID vaccine, that has a lot of the national Black leaders, as well as you know, national vaccination leaders. And there will be other versions of this, you know, perhaps related to Latinx or healthcare workers or long-term care, et cetera. So there's some content being created here, some national content we're working to really push out. But I encourage you to educate, ask these questions, and we will try to stay in good touch with you. If there are questions that you're not seeing really on the website or that you don't think you're getting the answer to, let us know. If there are things that are coming up frequently when you're out in communities, we really want to know that. As we develop more town halls that are aimed at individual community areas, we'll want to be focused on some of the concerns that we're hearing in those areas. So you are going to be really our eyes and ears on the ground, as you have been already, many of you, and you're going to be our voice in terms of really wanting to make sure that you're bringing the correct information with a Chicago sort of flair to it. So we'll want to talk about, you know, what do we know nationally, and then what do we know in Chicago? If there are any concerns that come up related to safety, related to efficacy, related to anything, we will absolutely let you know that, because we want to be very, very transparent about any problems, any concerns, so that we're honestly answering people's questions about it. I always want to be honest about what we know, what we don't know, but on the things where the data is very good, we want to help people feel secure in making that decision for vaccination. So I think with that, I will hand it back over, because I know there's a lot to discuss. But thank you again for the work that everybody is already doing and that you're going to do. And I look forward to continuing with you to help answer the questions that Chicago has and is going to continue to have. Thanks very much.